drugs are more valuable than gold on a dollar per gram basis. Marijuana is the price of gold on a dollar per gram basis right now. Cocaine and heroin are 5 or 10 or 20 times the price of gold, dollar per gram. Now, why is that? It's the magic of prohibition. Prohibition is like alchemy in the Middle Ages. You know, in the Middle Ages, chemists called alchemists tried to figure out, how could I turn lead into gold? Congress solved that problem. Prohibition. We take a plant like marijuana. You can grow it in your backyard. You can grow it in the living room. You can grow it anywhere. And you make its leaves equal to gold. You know, your mama told you, money doesn't grow on trees. Wrong. Under prohibition, money grows on trees. That's a fact. I've been looking at prohibition and the war on drugs professionally for over 30 years. Prohibition doesn't work. It creates more crime than it prevents. It leads to violations of civil liberties. It's costing us economically an enormous amount. The war on drugs is a slogan that has justified an uncritical approach toward thinking about the problems of drug abuse in our society.
We created the war on drugs. It was actually coined and created by Richard Milhous Nixon in 1968, and it was funded in 1970 by the U.S. Congress, so that's when I date the war on drugs from. It's been raging now for about 40 years. We spent more than $1 trillion already on this war, and every year we continue it, we'll dump another $70 billion down that same rat hole. And all we have to show for that money is that by now we have made more than 39 million arrests in this country for nonviolent drug offenses. We've done everything we can do to destroy those people's lives, put them in prison, make sure they can't get a job when they come out, no education. Done everything we can do to remove their hope for the future. And of course, when we're doing that, we're also removing any reason that they would have to stop using drugs.
I started in police work in 1969. In the early part of the 70s is when the big bus came, the French Connection bus. They made a movie. In fact, they made 2 movies about it. One was the movie entitled The French Connection, and the other one was a movie entitled Panic in Needle Park. That was a 20-pound heroin bust, the French Connection. They took 20 pounds of heroin off the street. It created New York City a period of panic because there was a shortage of heroin on the streets of New York City because of this arrest for about a month, month and a half. Today, we seize drugs by the ton. By the ton. And we never see a shortage on the streets. That's what we've accomplished in 40 years of this drug policy.
You know, if you look at the evolution of the oppression of African Americans in our society, you go from slavery, then you go to Jim Crow, and then you go to the war on drugs. What other system has worked so well for sweeping huge numbers, in some cities upwards of 50% of all young black men, into a system where they now have a criminal ID, where they now are registered, where they now are treated as something less than second-class citizens? What other system sweeps millions of people into places oftentimes far from their home, where they're giving a number, a loss of identity, obliged to work for little to no money, separated from their families, deprived of the right to vote? I mean, that's American incarceration today, and it rings a lot like American slavery a long time ago.
I'm an economist. I teach in the Department of Economics at Harvard University, and my position on the war on drugs and prohibition is that these are incredibly misguided policies that are incredibly counterproductive. The U.S. would be far better off if we legalized all these drugs and treated them under the law the same way we treat alcohol, tobacco, or even Starbucks coffee.
I envision a system where everybody involved in the cultivation of coca, opium, marijuana, in the shipment, in the manufacture, in the processing, and in the selling, and in the using, is subject to legal control.
We would set age limits for the distribution of these products. We would set distribution point controls for the distribution of these products. We would guarantee purity to the person that was buying these products by making sure that they were manufactured in a legitimate, legal, regulated marketplace.
Their economic activities are subject to taxation. They're keeping records of their inventory. They are subject to inspection by government officials to make sure that the drugs are not adulterated, that they're subject to labeling requirements. They have to have insurance policies. They can be sued in court for their misconduct.
Then we have to start educating the public into safe use, proper control, more money for treatment facilities and those kind of things for the people that do have problems, and moving forward to dealing with our drug problem in society.
All of the enormous variety of tools that are available in the private economy now would be applied to govern and control in a, quote, system of legalization.
We have 2 legal drugs in the United States of America, alcohol and tobacco. We have shown no ability to keep those drugs out of the hands of kids. If you legalize drugs, if you legalize marijuana, there will be an explosion in use, and it'll be among kids. People don't start to use drugs when they're 28, 29, 35 years old. Talk to people that are hooked. Virtually all of them are hooked when they're teenagers. We know that if kids start drinking at early ages, they're much likely to become alcoholics. We know that 90% of the people who smoke cigarettes who are hooked, 90% of the adults who are hooked on cigarettes were hooked as teenagers. If we legalize drugs in this country, I guarantee you that we will have a tremendous increase in drug use. We will really savage our children.
There is so much mythology in the war against drugs because people are trying to do the right thing. Unfortunately, for the people who advocate the single silver bullet of legalization, that isn't going to work. You need a balanced approach with education, prevention, treatment, law enforcement, foreign policy, the media campaign. That's how, in the last 3 decades, we've reduced drugs by almost 50%, from 14% of the population that use drugs once a month to some 8% now. If you had any other social program, illiteracy, hunger, poverty, lack of health insurance, that was reduced by 50%, would you call it a failure? No. You would say, let's do it, let's keep doing it, but let's do it better.